guys, look at this question here. The following are guidelines for thrombolysis for CVA, except, that is for cerebrovascular accident. When will you do thrombolysis? Except something. Okay, so now here there is a thrombus which is limiting the blood flow, right? So on the other end, what do you have? Ischemic stroke, right? Because of no blood supply. Now you want to do what? Thrombolysis. You want to do what? Thrombolysis. You want to go and lyse the thrombus. When will you do this? Okay, they are asking when will you do thrombolysis? What are the guidelines? Okay, so the neurological signs should be minor and isolated. If the neurological signs are minor and isolated, then don't do, right? If it is minor, so this is not the guideline. Okay. So this itself is your except answer. Neurological signs should not be clearing spontaneously. Correct. So if the neurological signs, the deficits are not clearing spontaneously, right, then you will do thrombolysis. One of the guidelines. Okay. Then the symptoms should not be suggestive of subarachnoid hemorrhage. So you should not have any hemorrhage. If you have hemorrhage and you do thrombolysis, what will happen? You might bleed more, right? So the answer here is the except answer. The neurological signs should be actually measurable, big, not minor. Okay. Now let us look at all the other guidelines. Okay, look at this. So in order we will go. It is very easy. Please understand here. The neurological signs should not be minor. Obviously, it should be measurable. It should be something that you want to actually thrombolyze, and that neurological signs are not clearing by themselves. And what is your diagnosis? First of all, it is an ischemic stroke which is causing this measurable neurological deficit. So this is the first thing, the ischemic stroke. Okay. Then once you do thrombolysis, he might go into bleeding. So you should check he's not taking any oral or anticoagulant. What is the INR, etc. Then he should not be bleeding anywhere. No subarachnoid hemorrhage you should suspect. There should be no GI hemorrhage. There should be no prior surgery in the past 14 days. No prior history of intracranial bleed. No trauma, bleeding evidence, okay, or any arterial puncture. Again, you don't want him to bleed, right? Then look at the 11th point here, guys. Let's look at the 11th point here. So this blood pressure also should not be very high. It should be below 185 systolic and 110 diastolic. This person should not have any previous prior stroke or head trauma in past 3 months. No prior MI in past 3 months. No stroke, no MI in last 3 months. And when will you, this is the last point written here. The treatment, after all this history, taking everything and diagnosis that you have done, the treatment you will start within 4.5 hours of the onset of the stroke symptom. Okay.